So it's been a long time since I made a video, but I wanted to focus on some of the more common things that we see in my office so that I make sure that we cover what you need to know and that the information that you get is consistent with what we get with every other patient. So one of the things that I see most often is rib pain. And rib pain is characterized by a stabbing kind of pain in our back. Oftentimes it hurts when you take a big deep breath in, but at the very end of that breath is when we start to see that jab you at that one point. We also see that it can refer around to the front on either side, following the pathway of what we call the intercostal nerve, the rib between the nerves. And if you guys are meat eaters, you'll have seen this before, where you have a rib, and you'll see the muscle in the inside, and there's this little white thing inside there. You wonder what that is? That's nerve. And it's great, right? But the reason that it hurts is it radiates following the pathway of that nerve. We also find that people who bend over and they're slumped over in their chair like this, working like this all the time, they're the ones that get it. Also chiropractors. Chiropractors are really common to get this because we're bent over our patients when we get lazy, and we'll adjust them, round out, and what that does is it allows those ribs that sit in our back to move backwards. And as soon as they do, they subluxate out of their position, and when they subluxate out of the position, it hurts. And so the problem with this condition is that it hurts when you get it adjusted. It hurts to get it fixed because that tissue is already inflamed. You know that, I know that, and so it's never the best introduction to our clinic, but it really does give you an idea of what chiropractors do, moving bones into positions that they need to. So what can we do here in the office? Not a whole lot. We can teach you how to do the exercises. We can teach you how to manage your posture at home. But really what we're limited to here in the office is getting that bone back to where it needs to be. And in that case, that means pushing it forward, getting it from the back to the front, into that position that we need. There are a couple rare cases where people will actually move their ribs out of alignment in their chest bone here, right on the sternum. And when we have that happen, we get that same kind of what we call anterior rib pain. And instead of pulling it back or pulling it forward, we'll pull it back into position. It doesn't change the fact that it hurts when we get it adjusted. I'm sorry to tell you that. But there is a lot of stuff you can do at home. All of this really vibrates around the concept of doing extension. And extension is where we take our spines, and instead of being in this forward flex position, we alter our position so that we're in looking up to the ceiling. That motion, extension, using the muscles on the backside of our spine, pulls our shoulder blades together and covers up those ribs that are causing the problem. And so when we start to look at that, we want to make sure that we get you so that you're building those muscles into extension. When those muscles build into extension, it pushes the rib forward, the problem's gone. This is one of the few times that you'll hear Dr. Carr use the term bone out of place or the BOOP theory. That's not what we want to typically work on here in my office, and so we want to make sure that we get those tissues moving. The best part about the ribs is that where the problem is also where the pain is, and so we want to make sure that we're addressing the cause of the site. And so I'm going to take a break right now. We're going to start to work on some of the extension exercises, and so I'll be right back. Well, I'm back. I forgot a couple things, and so I want to make sure that we're looking at where you're sitting. And so one of the best things we can do with you is to make sure that you're lifting your chest bone up to the ceiling. This small change in your posture drives the extensor groups in your back and forces that extension that we're looking for so desperately into your spine. Again, we're going to be working on the muscles of the rhomboids in the middle part of your back. That is a really easy exercise that we can start to work on here. Easy way to do that is just to get into lay back into a corner, put both walls on either side of you, and pull your body away from the wall so that you're working the extensors between your shoulder blades. And when you do that, it slides those shoulder blades together, tightening those muscles and forcing those ribs forward, which is almost exactly what chiropractors do when you go to the office. We're really forcing those ribs to move forward. Anytime we get that motion, it's going to help us out. You can also do a foam roller on your back, where you're laying back over top of it, rolling back and forth over top of the foam roller. Excellent activity for you guys to do at home. You can also take a tennis ball, put it in a sock and throw it over your shoulder and put it right where the rib pain is. Like I said before, where the rib pain is typically where the rib problem is as well. So putting these pressure points onto there, always driving forward into extension, is going to be the key to getting rid of this problem. It will also be the key to getting rid of it forever. So when we start to see somebody coming in, especially when they're working out a lot and they're doing upright rows and they're doing this all the time, I want to teach them how to do this motion where they're sliding the shoulder blades back in between, working those rhomboid muscles. The rhomboids are shaped like this, and so that's why we call them the rhomboids. We want to bring those things back in together so that we know that we're not going to be having this rib problem going forward in the future. If you didn't treat this, it'd go away within 2 weeks. But having treatment in a chiropractor's office means that we're going to get those bones moving the way we want to in a much shorter period of time. 3, 5 days, you're out of it. And that means you don't have that ice pick kind of pain in your back. We really want to make sure that we take care of that when you come into our clinic. Of course, you can ice it if you like. It's an inflamed tissue. You could probably even tape an aspirin to it to get some anti-inflammatory going on. But this is a structural, physical, mechanical problem, and we need to get it fixed in that same way. And so the more that we can get extension into our spines, the quicker the problem goes away and the quicker you're out of pain. So I hope this answered some of your questions for the ribs. If you have further questions, don't hesitate to ask us. You can check on the I think we have a link down below for where our website is, and there's also some over to the side or one of these other sites. There is a link to our other videos too, so it may be that I've steered you to go to other videos here on my page. So you don't have to like and share. That's not important to me. I'm not going to make my money on YouTube. I want to see patients in my clinic instead. So I look forward to seeing you in my clinic. Have a great day.